Part 5. The live presentation of your concept. You have now developed your concept in detail, exactly as described in the videos of Parts 1 through 4 of the module Concept Development. You have undertaken a thorough and systematic elaboration of your concept, ensuring that each component is carefully designed and supported by evidence. You now have a clear and well-founded understanding of why and how each individual tool addresses the specific symptoms and clinical challenges of your selected target group. From the complete set of 12 available practical tools, you have selected a maximum of 10 to create a program consisting of 10 separate sessions. Each session is dedicated to the application of a single tool. There may be clinically justified reasons, based on the specific needs of your target group, to repeat a tool in more than one session. However, such repetitions should remain the exception, so you can make full use of the variety of new embodiments and achieve the greatest possible benefits for neuroplasticity. As NeuroTango and the neurotechnical tools are still relatively new and not yet widely known, and as many people do not yet have a clear idea of what tango therapy actually involves, you will most likely be invited to present your work at various talks, professional events, and demonstrations. This curiosity from others gives you valuable opportunities to explain and showcase your concept. Your success in these situations will depend on showing both professional expertise and empathy. That is why it is essential to begin by demonstrating that you understand the symptoms, needs, and challenges faced by your chosen group. After that, you present your approach as a structured and effective solution. While doing this, you can refer to the improvements that have been reported in specific symptoms as documented in our patient and participant testimonials. By the time you reach this point in your presentation, your audience will already have understood two important things. First, that you have the clinical and methodological expertise to address their needs. Second, that there is already evidence of positive outcomes with your method. It can be very effective to hand out a printed overview of relevant studies that support the benefits of tango therapy. You will find these studies on our official website in the Science section, in the appendices of both reference books, and in our school group. When you speak about research, it is important to explain that the evidence is not based only on studies focusing exclusively on tango therapy, although such studies do exist, but also on scientific research into each individual component that contributes to improving symptoms. The components of NeuroTango include music, movement, touch, communication, embodiments, physical regulation of frequencies, relaxation, movement meditation, neuromotor exercises, neurocognitive exercises, and kinesiological activities. For the purpose of this presentation, we will not go into the detailed scientific mechanisms of action of each individual component. Instead, we will briefly mention them and provide written material that participants can review afterwards. A full explanation of the therapeutic effects and clinical relevance of each of these components for different conditions could easily take a full day of training. Each one is backed by an extensive list of scientific studies and is used in other well-established therapies, such as occupational therapy, physiotherapy, dance therapy, music therapy, osteopathy, brain training, and kinesiology. NeuroTango brings together the most effective elements from these fields and combines them with the unique potential of human communication and touch, either within a group of people who share similar conditions or together with a partner. For people with chronic illnesses in particular, the presence of a trusted partner or close companion during therapy classes is often experienced as highly supportive and motivating. We now come back to how your live presentation should be structured. Every presentation begins with a personal welcome, a word of thanks to your audience, and a clear introduction of yourself by name and professional background. You then give a short, clear explanation of the therapy method, so everyone knows what it is about from the beginning. Keep this introduction brief and focused. Any further details can be discussed during the question and answer section at the end. In most settings, you will have between 10 and 15 minutes for your entire presentation. Sometimes, the most powerful way to begin is by presenting the observed results before you explain the methodology. In this section, you can speak about the clinical improvements and symptom-specific changes that have been consistently observed since 2013. From a scientific point of view, it is essential to describe these as patient-reported outcomes and therapist observations, rather than making definitive claims about efficacy unless you have published research to support them. After this, you explain the formal framework of your program. This includes the length of each therapy class, the total number of classes, and how frequently they take place. One important rule is never to describe the full session plan verbally during a presentation. While you can hand it out as a written document, going through the details orally often feels confusing, less engaging, and does not build enthusiasm for the method. You should also mention the expected number of participants, the required size of the room, and the necessary equipment such as a sound system, chairs, mirrors, and a smooth, even floor. If time allows and your audience consists of experienced professionals, you can give a short overview of the therapeutic aims of each class. For example, in the first class, we work on fluid movement, upright posture, and expressive movement to help visualize the therapeutic goal. This new movement habit can help align thoughts and emotions with the desired outcome. Depending on your target group, you may focus more on physical, psychological, or neurological goals. When presenting your program for the NTT Practitioner Certificate, you name all selected tools and explain their specific benefits for the chosen group. You can choose your target group freely, which makes it easier to design an effective concept that draws on your professional expertise and, if applicable, your personal experience. It is helpful to prepare a working sheet listing all selected tools along with the therapeutic objectives for each, specifically adapted to your chosen target group. The presentation for certification is not an examination, but a sound knowledge of the tools and their application is expected. As in any professional discipline, skills such as movement technique and didactic delivery will continue to improve over time with practice and experience. The most important thing now is to take the first step and begin putting your concept into practice without delay.